Hello, 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 and welcome to another exciting episode of the Lagos Youth Show on Lagos Television. And as usual, yes, this is the show like we always used to say it. This is that one show when we bring you everything that concerns the young people of Lagos State. Of course, not to forget, we bring you gist from the young, exceptional, and amazing mind from the city of Ikeja down to Badagry, not forgetting Ikorodu. Oh, interestingly, we do Lagos and our interesting young people in Ekpe. All of that we bring to you in one show, one stop, and one conversation. And as usual, we promise today's episode is going to be one of the interesting ones that we always bring to your table, not like other. Of course, I would be your solo host for today on this episode. And let's keep the conversation. Let's keep the energy. My name is Tosin Ikuyimenu. See you soon. We'll be right back after the short break.
Today is World Sickle Cell Day, and I want to take a moment to share something that my team and I have been working on. This year, through the Adekunle Gold Foundation, we're launching a new program called 5-Star Care, a free health insurance scheme for 1,000 people living with sickle cell in Lagos, Nigeria. We believe that every life deserves 5-star care, no matter where you're from, what you earn, or what you're going through. This program is made possible in partnership with the Lagos State Ministry of Health, LASHMA, and Sickle Cell Management Initiatives, SAMI. Our goal is simple: to ease the financial burden of managing sickle cell and help more people get the quality care they deserve without stress. And as somebody who's walked this path, I know how powerful it is to have the right support. This is just the beginning.
Yes, it's still the Lagos Youth Show. And as I said initially, we have an interesting conversation we're going to be having today as it relates to young people as usual. But this time around, we're going to be diving it a little bit different from our usual conversation as it relates to sickle cell disorder. Of course, sickle cell disorder is one of the raging cause of concern, particularly here in Nigeria, as it's known as a common disease with over 150,000, newborn babies every year, giving birth to with this disorder. This, of course, is causing a range of conversation, and it's something that we must take of utmost significance as we have a lot of issues surrounding sickle cell, particularly as a result to poor awareness, social stigma, and many other issues, particularly as it connects to the poor healthcare we have here in Nigeria. All of this and more of the conversation is what we're going to be discussing today as we have a guest that will be joining us in the studio who is a researcher and a sickle cell advocate, which is no other person but Fatima Oyawoye. It's great to have you, Fatima. It's great to have you.
It's a pleasure to be here. Thank
Beautiful,
you.
beautiful. Thank you so much. All right, let's just go straight to it, right? Particularly, I most of the times it's good we always not assume that a lot of young people are aware as to what sickle cell, disorder is all about. So we would like for you to just give us a little bit of background as to what it is all about, so we can educate young people out there.
So basically, sickle cell disease is a genetic disorder. Basically, it affects the red blood cells, particularly the shape of the red blood cell. So the normal red blood cell is meant to be round, quite flexible as well. But when it comes to sickle cell disease, it has a sickle form, which is something like a crescent, like an half moon sort of. So this sickling, or this process of sickling, is what causes sickle cell disease individuals to be in so much pain and also like lead to like organ damage and so many other complications of sickle cell disease. Um, Individuals with sickle cell disease have the genotype SS or SC, whereas the normal individual without sickle cell disease have the genotype AA. Now, individuals who are at risk of giving birth to children with sickle cell usually have the genotype AS or AC.
Interesting. Thank you so much for that clarification. And with regards to that, I mean, you have quite a number of experience being an advocate, and you've seen a lot of issues with regards to this concern. Would like to know what are the challenges, particularly in Nigeria, sickle cell warriors face. We'd like to hear from your thought on that.
Just clarification's sake, you mean challenges in terms of like diagnosis, or should I say just sickle cell at large, patient-based, or my experience as an advocate?
Yes, and I would like to know, particularly for sickle cell warriors, like what are the challenges they face, particularly with healthcare services and a lot of that.
Okay, so one of the problems with sickle cell disease is these patients usually have painful episode, or should I, and also anemia, which is low blood levels. The major challenge is in terms of like the healthcare facilities and what people have access to, basically. As an advocate, I go to small communities to provide sickle cell testing, and we've come to realize that there are a lot of even known sickle cell disease cases in those communities. The problem is they don't have access to a facility where we have specialized care for sickle cell disease. So in Nigeria right now, there is a huge shortage on number of hematologists that are available to patients, and also to patients with sickle cell disease. So that's kind of like reduces their lifespan, because they're not getting the adequate amount of care that they're supposed to get. And then also with sickle cell disease, there's this huge stigma around what sickle cell is, and like there are claims that people who have sickle cell disease die early and all of these things. It's caused a lot of social issues for individuals with sickle cell disease, so they're unable to like live their lives to the fullest, as they're unable to associate with general individuals, especially when they are not educated about what sickle cell is.
Oh, wow. Thank you so much.
Yeah.
Thank you so much, Fatima. I like that clarification. In fact, I like the fact that you spoke about social stigma, because, I mean, it's one of the major issues we have, not just with sickle cell disease, but many other diseases or healthcare issues. But I would like to ask, let's really look at it properly. Are people really as aware as we think they are, particularly with sickle cell? Because, I mean, the last time I personally had an experience or a situation whereby someone educated me about some of these things, the conversation we are having, was quite many years ago. So, are we really doing well with regards to awareness of the issue?
No, I don't think we're doing just enough as a community at large. Again, I'm a sickle cell disease advocate, and one of the things that I spend a lot of my time doing is really educating people about what sickle cell disease is, and like also providing tests to individuals about sickle cell disease, and providing tests for sickle cell disease. Now, when it comes to awareness about sickle cell disease, I think that for a country with the highest burden of sickle cell disease in Africa, or West Africa, if I might like to be specific, we are doing a terrible job. I think most effort when it comes to education about what sickle cell disease is and raising awareness about sickle cell disease have come from like private organizations and NGOs who have taken it upon themselves to, make awareness about what sickle cell disease is. There's little to no government intervention when it comes to like awareness about sickle cell disease. Ideally, in our country, I think that sickle cell tests should be free, but it is not free. People have to pay to be able to access these tests. Also, community leaders are not entirely educated about what sickle cell disease is. So there's also a knowledge gap going on here. It's not just about like people being aware, like there's a knowledge gap. People don't have facts. We have myths. Like people who have sickle cell die early. We have myths like sickle cell is contagious from like hugging someone who has sickle cell disease. These are all lies, and these are things that we've held on to because we refuse to look for the facts about what sickle cell disease is, right? So there's really no knowledge about what sickle cell disease is. There's also barrier. One of the major barriers that we are faced as an organization when it comes to raising awareness about sickle cell disease is language. When you can't explain the science in a language that somebody can understand, it becomes very difficult to actually pass a knowledge through. And at our organization, which is the Fatima Oyawoye Foundation, what we've done is we are trying to break that, that barrier by bringing down the big scientific words into understandable languages for people to understand what sickle cell disease is. And for children as well, we've now created like innovative ways to explain sickle cell disease to them through coloring books, playing with clay and the likes, just to understand what sickle cell disease is.
Oh, beautiful, beautiful. Thank you so much, Fatima. In fact, I was about to ask you, what do you think, what are, particularly in regards to awareness, what do you think are those things we need to start doing differently? But I like the fact that you already pinpoint some of that. But going back to the previous, thought you gave with regards to facilities and affordability of some of the services, I would like to hear your thought with regards to health insurance. I mean, there are a lot of interesting health insurance, package and services, particularly in a state like Lagos State, where you have the Lashma, like the Ilera Eco project, where people access some of these generic healthcare services. Don't you think that in return is already sort of solving or addressing some of the issues beyond just sickle cell, but all other services that people will need as it addresses that? And if you don't think that is a direct solution, what other solution do you think the government and also private sector can implement to see how we can address the issue with sickle cell warriors?
I think there are works in the pipeline when it comes to, access to some of these healthcare facilities, especially in big cities, for example.
Okay.
There are good work in the pipeline. I would not say it's not enough. I think that we should just aim at like improving it. When it comes to like insurance, for example, for sickle cell care, based on other people's experiences, it doesn't really cover it all. For example, when a sickle cell patient presents at the hospital with like painful episodes, the cheap pain medications do not necessarily help.
Okay.
They have to keep being on these opioids for a while until their painful episode goes. And so a lot of these insurance companies or agencies have a cap on how much of these medications these individuals can have access to. When there's a cap on it, at some point, the patient then has to start now surface for pay for their own medication at the end of the day. So these insurance organizations do not really cater at large to what the requirements of the sickle cell patients per se. Another thing is like complications that arises due to sickle cell disease. If you've been frequent on social media, you would be aware that a lot of sickle cell patients are coming out and seeking funds for what is called an avascular necrosis surgery. So an avascular necrosis here is just a damage to the femoral head. So in this case, these individuals need to have an hip replacement done. Hip replacements cost millions. I'm talking anything from 7 million upwards.
Wow.
Now, there are no insurance per se in Nigeria that covers such a surgery. And avascular necrosis, patients who have avascular necrosis, basically they can't move freely. They are in constant pain and they are unable to go by their normal activity. It's quite bedridden. It's such a bedridden condition that comes with sickle cell disease. So in as much as something like the Lagos State is pushing so much effort into bridging the gaps when it comes to access to healthcare facilities and all of that, there's just still a lot more to be done. I think we're doing the best when it comes to emergency care, but beyond that, lifelong complications that these individuals have, what are we doing? There's still that gap that is not filled.
Okay. Thank you so much for that clarification.
Most of these
thank you so much for that clarification. Because of time, thank you so much. Let's take it. Let's go a little bit back to the root cause. All right. As much as we are trying to solve the problem, like the popular saying goes, prevention is better than cure. Let's look at the root cause. Right. I see a lot of conversations on social media where young people talk about, I don't care whatever my genotype is, whatever my blood group is, as long as I love her, you know, as long as I love him, I am ready to do whatever it takes. And sometimes, you know, when you see young people, particularly the Gen Zs, you know, have make some of these statements on social media, you see that their level of awareness on some of these issues is quite, you know, different. I would like to hear your thoughts. What are your thoughts with regards to how young people should see these things and how they should take the conversation of sickle cell seriously in order to, you know, start positioning themselves for prevention?
I think the mere fact that people are not aware of what it means to have sickle cell disease makes it easy to make such a careless statement.
Oh, okay.
You know, it's like cancer. People don't know what cancer is, but recently, with the uprise in number of patients with cancer and seeing how difficult it is to have it, people are now more conscious about what they eat and how they handle their life. It's the same thing with like sickle cell disease. I think because people don't know what sickle cell really entails, they're able to make such a blanket, such a bad statement saying that, you know, they don't care about what their genotype is. But thankfully, like, there are a lot of warriors out there who are actively like showing what it means to have sickle cell disease and like showcasing their lifestyle, what they have to go through as an individual. If you've been to the hematologist unit in any teaching hospital and you see sickle cell patients in pain, you would understand that when you are getting married and you're ready to have children, you would never want to put your children through that.
Well, thank you so much, Fatima. In just few words, wrapping up the conversation, I would like to hear, for example, let's say you have an opportunity to meet with the governor or a major policy maker in Nigeria. What are your few words to them with regards to sickle cell care in Nigeria, particularly with regards to the attention given to them, investment, should I say investment, like, investment by the government and policies to mitigate it and all of that. What are your few words to them with regards to sickle cell care?
I think my words would directly focus one on research. Despite having the highest burden of sickle cell in the world, like thankfully we have a lot of organizations that are raising awareness about sickle cell disease, but there's little to no organizations that are primarily focused on doing research on sickle cell disease, finding drugs, finding therapy on sickle cell disease. I think our governments need to invest into research that goes into sickle cell disease. And I also think that we should now start looking at creating funds and pockets for sickle cell disease healthcare, and most importantly, making sure that these healthcare changes are not limited to the big cities. They are also accessible to rural environments where, should I say, even cars can't go there. Yeah.
Oh, beautiful, beautiful. It's been an interesting conversation with you, Fatima. I took a lot from it, and I'm sure many other young people here in Lagos also took a lot. But please, as we head, we need to be conscious of our decisions and our choices. And as we get some of this information and as we know better, it's advisable that we take wise and reasonable decisions. Thank you so much, Fatima. It was great having you on the show.
Thank you for having me.
We look forward to doing more of this with you. All right. Okay, that is it with Fatima. It's been an interesting conversation, and I myself personally have learned a lot. Let's go on a quick break, then we'll wrap up the show. Yes, it's still the Lagos Youth Show, and it was an interesting conversation. I mean, it was mind-opening. Myself, I took a whole lot. I mean, I almost assumed myself to be the governor of Lagos State at some point, hearing some of the interesting perspective Fatima gave on the show. We need a lot of support. We need a lot of support to tackling sickle cell disorder in Nigeria. And of course, for every young person out there, we can't afford to be making uninformed choices. It's very, very important that we do the necessary tests required before we engage in any form of, exuberancy. And I know there are a lot of exciting conversations on social media, but our advice, just as we've heard from Fatima, that we seek the right information, we seek the right knowledge so as to ensure that we make the right decision and choices. That's it on the conversation on this episode, and it's been an interesting one. As usual, the conversation doesn't stop here. Follow us on all our social media platforms on Facebook, X, and Instagram at the Lagos Youth Show, and on Facebook, X, and Instagram at Lagos Television. As we keep up the conversation, let's keep up the energy. Remember, your health is a key priority. My name is Tosin Ikuyiminu. Keep the vibe, keep the energy, stay jiggy.